Okay, shin pain. So the first thing we talked about was the anterior compartment issues. This is about rehabilitation. These muscles have become stuck in their holding pattern. They've learnt to protect, and we need to break those holding habits. So manual therapy, massage, soft tissue release, fascia work, all of these are really good, but then we have to get the muscles working differently. So they're all working together as one unit. We need to start working them in individually, and this is basically lots of TheraBand work with activating the muscles against resistance. So the foot, the big toe, and also the toes all working independently to re-establish this good muscle function through here. Reducing the load that you're doing is going to be beneficial in the short term as well, because continually loading these muscles to the point of fatigue means they're going to just go into that holding pattern very, very quickly, and they learn to do that. So we need to take them to that point and back off. So using more interval style training is good rehabilitation for all muscles, not the continued long runs. And sometimes taking up the intensity is a really good way of doing this as well. So this will be for the anterior skin compartment, the lateral side on the perineals, and also on the medial side as well. If any of these are irritated by that long continuous running or walking, then reduce how much you're doing. Take them to that point where they're becoming a problem and then back off. So either on a walk run program, or if you're walking, just taking a break and just letting these things settle down before going again, as well as the TheraBand. So isolated, specific exercises for those muscles with a TheraBand against resistance. Shin pain on here, if this is a bony irritation, again, it needs rest and not to be aggravated, which again is taking the activity levels, that loading, down to a level that it's able to cope with. And not continually keep loading it, it won't get any better. We've got to reduce that damaging impact, take it back down below that level, let it settle down, and then start to build again. Looking at the way you're moving is going to be really important for all these things as well. So if you're running, good gait analysis to understand why these muscles are doing more than they're happy with, and then putting other treatments into place. So there may be orthosis, maybe gait re-education, maybe strengthening other areas higher up, so dynamic core, even the way you're holding your shoulders, your head, the way you're using your whole body in the running technique is really, really important. It's not just the pain you're getting down the inside of the shin, but it's how your shoulders sit, how your head sits, how you're moving your body as well as training. All those things will start to become much more important with these type of shin pain injuries. We have to look further afield into the rest of the body.